today for, I actually don't know which number this is in our webinar series, but the Center for Community Solutions and Advocates for Ohio's Future have been partnering over the last several weeks on webinars to share information with everyone in Ohio about how the pandemic has impacted various health and human services. And today we're focusing on childcare. So I want to thank you all for joining us in this series. And for those of you who aren't familiar or haven't joined us before, I'll share a little bit about Community Solutions and then turn it over to Kelsey to talk about Advocates for Ohio's Future, and then she will introduce our panelists. So the Center for Community Solutions is a nonpartisan nonprofit that aims to improve health, social, and economic conditions through nonpartisan research, policy analysis, communications, and advocacy. You'll see on your screen our 6 policy priority areas, which really run the gamut. And so many of the things that we've talked about on these webinars fits directly into the things that we're working on all the time. So I want to, again, thank you all. Just a few logistics. We will be sharing the webinar slides immediately after the webinar concludes on our website, Community Solutions, as well as on Advocates for Ohio's Future website. We can put those links in the chat. I think some are there already. We will also have a recording of the webinar available, posted to our websites later on as well. So you can check those out or share with anyone who wasn't able to make it today. We will take questions via the chat box. So if you can submit those in the chat box, we will be keeping a running tab of them through the webinar and try to get to as many as we can in the last few minutes today before we run into our 2 o'clock stopping point. So I want to thank you again for joining us. Thank you to our panelists for joining us today. I'm really looking forward to hearing about this. And I'm going to turn it over to Kelsey to do some brief intros before we get to the content. Thanks, everyone.
Great, Tara, thank you so much, and good afternoon, everyone. Happy Friday. My name is Kelsey Bergfeld. I'm the Coalition Manager for Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of a wide range of health and human services, policy, advocacy, and provider organizations. We really work together to make sure that there is public funding and policies that support the health and human services and early child care and education, especially as it relates to lifting up our most vulnerable among us. So today we are very, very excited. First, I would like to announce, so AOF, we have a revamped website. If you would like to check it out, the advocatesforohio.org, and also our website materials will be up there with Advocates for Ohio/webinars. So make sure you check it out. And then today we are very excited to have such an incredible group of advocates and policy analysts with us today, talking about, again, the changes that are coming to childcare as a result of COVID-19 and what it could look like in the future. So today we'll be joined by Linan Gutierrez. She is the Policy Director and Legal Counsel for Groundwork Ohio. We have Kimberly Tice, the Executive Director of the Ohio Association for the Education of Young Children. And we have Shannon Amos. She is the Vice President of Programs at the Children's Hunger Alliance. So Linan, whenever you're ready, please feel free to kick us off.
Great, thank you. Good afternoon, everyone. It's Friday, for whatever that means these days, so I hope you all are doing well. My name is Linan Gutierrez. I'm the Policy Director and Legal Counsel at Groundwork Ohio. Next slide, please. We are the statewide nonpartisan advocacy organization focused on championing high-quality early learning and healthy development strategies from the prenatal period to age 5 that lay a strong foundation for Ohio kids, families, and communities. And I love this little picture of this guy here. He was served by childcare during the pandemic. His mom works at Amazon. So next slide, please. Just want to kind of review the timeline of where we've been and where we're at in terms of childcare in the state of Ohio. All childcare programs were forced to close as of March 26th of this year, unless they were operating under a temporary pandemic childcare license. And during this time, the state provided weekly closure payments to programs that typically serve kids in the publicly funded childcare program. So just as a reminder, our publicly funded childcare program serves working families. The initial eligibility requires that a family is at or below 130% of poverty. That's approximately $27,000 a year for a family of 3. So a typical family, mom, head of household, single head of household, and a preschooler, and then an infant or toddler. So that capacity is very important to us in the state, and so providers, in a recognition that during the closure they wouldn't be getting any type of support for their fixed costs and for the loss that they were having during closure, the state provided them those weekly closure payments that represented a typical week of attendance for children in their programs for publicly funded kids. And the temporary pandemic sites were receiving a high quality rate for serving children who were enrolled during the pandemic, during that mandatory closure. The temporary pandemic programs could only serve essential workers. They had limited teacher to child ratio and classroom sizes, and that was limited to 1 staff for 6 children for all ages during that pandemic care. Families who qualify for PSCC at that 130% of federal poverty eligibility, they still continue to receive subsidy for pandemic care. And then those families of essential workers who didn't meet that threshold continue to pay full tuition during that pandemic time. There were approximately over 2,200 pandemic childcare programs. They served about 25,000 children, which includes publicly funded and private pay children during that time. And only about 65-ish% of those kids were publicly funded. So we were about at 15,500 publicly funded kids being served during that time. That is a huge contraction of our system. We physically serve 117,000 kids in childcare in Ohio. So just a fraction of those being served during the mandatory closure. During that time, with certainly the support of the administration, the legislature extended the Step Up the Quality deadline to September of 2020. So for those of you who've been following childcare in Ohio, we have made incredible progress and investments in our quality system, which we refer to as Step Up the Quality. It's a 5-star quality rating and improvement system. And there are 2 statutory mandates that were benchmarking progress for us in the system. The first of which is that by the end of June of 2020, that all programs have to be rated a 1-star in order to receive public funds. And I am happy to announce that although that extension was properly made to September in light of the pandemic, that as of March prior to the pandemic, over 90% of programs had reached that 1-star level. So we're really in a great spot in terms of quality progress here despite the pandemic. Next slide, please. So again, the pandemic period ended in terms of the mandatory closure for childcare, and childcare reopened on May 31st, which for most programs meant Monday, June 1st. And all childcare programs were allowed to resume operations under their pre-pandemic license, but with new regulations. So you can imagine many of the emergency regulations regarding safety and sanitation were continuing to be followed beyond that mandatory closure period to keep children, families, and staff safe. Weekly closure payments stop now because all our programs have the opportunity to reopen, and programs have returned to receiving their pre-pandemic rates for publicly funded kids in the state. And rates are based on both what county they live in, the age of the child, and their quality rating. Programs don't have limitations on who they can serve, so they are able to serve any child who needs childcare. It's not limited to children of essential workers upon reopening, but the teacher-to-child ratios and classroom sizes remained lowered. So they've been relaxed a bit from the 1-to-6 ratio across the board during the temporary pandemic care, but they have been severely restricted in terms of safety for kids and staff. There has been a grant program stood up to help cover expenses and fill the gap between those pre-pandemic rates and the cost of delivering the service with these new ratios. Next slide, please. And I just want to give you all a little bit of more insight on what's really, I think, been providing or been giving the childcare industry and all of us a lot of pause. So the impact of COVID-safe environments on the childcare business model is very real. When you look at pre-COVID-19 adult to child ratios, you can see that while it's been relaxed somewhat from 1 to 6, that they are continuing to be much smaller ratios and group sizes than are accustomed to. And prior to the pandemic, childcare has always operated on really slim profit margins. So there are very few efficiencies in the childcare business, and those have really been wiped away with the reduction in class and group size. So we at Groundwork at our table, we focus on the needs of children and families, and the childcare industry and educators and many other stakeholders sit at our table. But I just want to say very clearly that we're really grateful to live in a state that has prioritized the evidence, the medical evidence, and safety of our families, of our children, and of our staff. And so we have really at Groundwork relied on the expertise of public health, not us at Groundwork or childcare, to make these decisions. But there is a very clear recognition that these safety decisions need to be resourced because we are at great risk of losing childcare capacity as a result. So the limits on class size and new ratios means programs have had to reduce their capacity by 30 to 50%. It means fewer kids can be served in the same space and more staff are required to provide care. Next slide, please. So when I talked about the grant program, I was really talking about resources that have come from the Federal CARES Act. So when we look at how our child care system is funded on a healthy day in Ohio, we are very reliant on federal funding. Most of the state investment is tied up in our maintenance of effort for our TANF funds, our Temporary Assistance for Needy Family funds. And we're very reliant on both the Child Care Development Block Grant and TANF funds coming from the federal government to support childcare in our state. So the CARES Act that passed in late March, it included $3.5 billion in additional funding for childcare. Ohio received $117 million. And half of that amount went to the cost of pandemic care. So those 5-star rates that I mentioned that were being paid out to programs providing care to essential workforce families. And so when pandemic care stopped and they were looking at reopening, about $60 million of that remaining balance was there to support childcare programs upon reopening with these lower ratios and with some increased expenses in terms of the supplies they would need to alter their facilities to accommodate smaller classroom sizes and to do the cleaning and sanitation practices that are required to keep families safe. That $60 million, I've been warning, and all of us have been communicating that wouldn't last long. And that money, we are confident will be gone by the end of July. So the grants are being administered for the month of June. There's an evaluation happening in terms of how that grant will look the month of July. And at the end of July, there's no reasonable expectation that money should be around. So $117 million, it sounds like a lot, but when you think about the fact that about 14.5 million typically on a healthy day serving 117,000 kids in Ohio goes out every week, 14.5 million every week for childcare reimbursement rates, you could see how that money is really not able to sustain us over a longer period of time. Next slide, please. So while certainly we're not letting the state off the hook, and there is a lot of work to be done to preserve current investments in the child care system, both in terms of state investment and the choices that we make with our federal investments, we have really pivoted our advocacy to Congress because they have the ability to make the type of investment that is required to sustain our childcare system. Our goal, and in partnership with many of our national organizations and other like-minded organizations and stakeholders across the nation, are asking for a commitment of $50 billion to childcare through an emergency act, but the dollars would flow through the Child Care and Development Block Grant Fund, and we would expect $1.67 billion to come to Ohio. And this began with wanting that to be included in the fourth federal stimulus package, which we all know as the HEROES Act. The House passed the bill, only included $7 billion. And that's pending introduction, was pending introduction in the Senate. And just to give you kind of frame of reference, the first CARES Act investment was $3.5 billion. The House passed included $7 billion for childcare. So you could imagine that the amount coming to Ohio would double. So that gets us several more months, but isn't going to solve our longer term 12 to 18 month prospects in terms of sustaining and being able to maintain some capacity in our system. Since then, there has been a standalone bill introduced, the Child Care is Essential Act. It was introduced first in the House, and it provides $50 billion to child care. Like I said, in the standalone bill, we have from our Ohio delegation, Representatives Beatty and Fudge representing that piece of legislation. And a companion bill has been introduced in the Senate, and Senator Brown just signed on, and we were notified that he signed on yesterday. So thank you to our Ohio delegation who's supporting childcare. We have still yet a lot of work to do to build the will to get the type of investment that childcare needs to sustain. I will also mention, this is separate in terms of maintaining capacity, but the House Democrats in Congress did release a transformational infrastructure bill. They are calling the Moving Forward Act. And for those of you who are interested or have been following kind of childcare facilities, if there's any indication that the childcare programs prior to COVID were under-resourced, facilities were among the kind of farthest on the back burner in terms of what funding would be available to childcare programs. And as part of this bill, where they're really trying to create jobs and update infrastructure, they have $10 billion allotted to childcare, and that may be also interest for those of you to follow who are following lead poisoning in young children and to the extent that which that could be happening in childcare and school facilities. Next slide. So I've underscored this a few times, but here it is in bold and red. The Center for American Progress estimates that without intervention, we could lose 45% of our child care supply. And that is just devastating and really hard for even myself to wrap my head around in terms of how critical childcare is supporting our workforce and our economy in the state. Next slide. So children and families need your help. Next slide. I just wanted to show you the sweet children. But I invite you to join Groundwork. We have regular opportunities to engage very easily in both federal and state advocacy opportunities. Please visit our website at groundworkohio.org to subscribe to our newsletter, and certainly feel free to contact me. We'll have an opportunity for questions after all the speakers are done. I do want to say that while I hope that I've expressed the urgency with which we present to you today in terms of the need to get more investment in childcare, that there is continues to be a thoughtful process happening at the state level, especially as we look towards school reopening, in terms of making any additional provisions that would be governed by the evidence, the best evidence at the time of what we could do to change practices to be smarter and more effective in containing the virus in childcare, and to better serve the needs of families. And so I look forward to continuing to provide updates as we learn more and things change as we progress into the school year. Thanks so much. And I am happy to hand it over to Kim Tice. So Groundwork Ohio is an objective, nonpartisan organization that's focused on kids and families, and but you're not doing childcare justice unless you're also listening to the voices of early childhood educators and providers in the field and children and families. And so there's no better voice for our providers than Kim. Thanks.
Thanks, Lynn-Ann. And thank you for providing Ohio AYC the opportunity to speak on behalf of the early childhood educators who are on the front line of this work every day. We are the national affiliate for the National Association for the Education of Young Children, so we are a professional membership association. However, we also serve early childhood educators in all settings, in all professional roles. We don't have state contracts, so we're able to be an objective voice for the individuals working in the field. So we, even before the pandemic, we had established a Power to the Profession network to recognize the importance of the work that early childhood educators do and to elevate their voice in decision-making at the state and national level. We also offer an annual conference and online webinars, and believe it's truly important to begin raising more leaders in early childhood educators to be at the table and find their voice and use their voice to influence decisions. I'll talk a little bit more about Courageous Conversations on the next slide, but we connect our work with the national office as well. So you can go ahead and go to the next slide. Thank you. So as I said, we empower all who care for and educate and advocate on behalf of young children. So even though there are some membership perks, we invite everyone to sit at the table and be involved and be engaged, because this profession is too important and the work they do is too important. So that is our mission, to empower all who care for, and we try to do that in a variety of ways. Next slide, please. So the Courageous Conversations was a result of when all of this information started coming out that it was likely that childcare programs were going to close and the potential of reopening at pandemic programs. We immediately started hearing from those who were on the front line who desperately wanted information to guide their work and guide their decisions. And if you can even recall your own work, I'm sure it was this way. Information was changing hourly, let alone daily or weekly. So what we wanted to do was provide a place where we could hear directly from those who were being most impacted by the decisions that were being made. So we've, from that point in time, met weekly through Zoom calls, and we made sure that we did not position ourselves as the experts, because we truly believe that those who are the early childhood educators are the experts in their profession. And so we needed to hear from them. And what we've found during this time is they really needed a place and an opportunity to process all that was happening and to co-develop solutions and share resources. Some of the recent needs that they've identified is a need for consistent and accurate information from local health departments. And as you know, there is no playbook for this, so even local health departments are on a daily basis trying to figure out the right response. But programs need consistent information from their health departments. We need weekly reports that they've identified on how many cases of COVID are being transmitted in childcare programs, how many of those are children, how many are families, how many are staff. So as they're looking at their protocols, they want that kind of information that helps them to plan and mitigate as much spread as possible in their programs. The overriding concern, and Lynn-Ann addressed this in her presentation, but not only looking at the ratios and they understand the health department's reasoning behind those, but they also want to be engaged and be informed about when those ratios may increase, at what time, because it's really hard to run a business when you don't have answers on those types of questions. So those are some of the recent needs that have been identified. If you could move to the next slide, please. 3 areas that have been consistent from the beginning, from even when we were doing the pandemic care to now when more programs have reopened, are staffing concerns, personal protection equipment, access to funding for that, and the lower ratios and smaller group sizes. Obviously, there's many more, but these are 3 overriding consistent themes that we've heard. If you can move to the next slide. So, 2 truths and a lie. Childcare programs are turning, there's a typo there, are turning children away. Childcare programs are struggling to enroll enough children. All families and staff are comfortable about the safety of group care. So we have been asked by a lot of people, are childcare programs full? Are they struggling to enroll? And through our conversations, what we're finding is both are true, depending on the location, depending on if there's the comfort level of parents, etc. Some programs are really struggling, and their issue is they have children and families that it's heartbreaking for them to turn them away because they may be families that were formerly in their care, but because of the lower group sizes, they don't have space for them. So how do you make a decision on which child and which family gets to come back to your program? And then you have other programs who are telling us we're ready for families, and we've brought our staff back, and yet we don't have the enrollment that we need to be financially sustainable. The lie, all families and center staff are comfortable about the safety of group care. This is very individual as well. There are some that were so eager to get back, children, families, and center staff, and yet there's others, maybe because of personal circumstances, personal health, are concerned about the safety of group care. Next slide. 2 truths and a lie again. Programs appreciate the lower ratios and smaller group sizes so teachers can provide more individualized care. Programs want to see increased ratios and group sizes to operate in a financially sustainable manner. Recent grants from the CARES Act will solve this problem. I think you can identify what the lie is there. And again here, both of the first 2 bullets are true, and we're hearing that message from childcare providers. One of the things that's really important is for us to get reliable data, and both Groundwork and Ohio AYC are partnering with NAOYC on a national survey so that we can get as much reliable data as we can to be able to actually report to the state, and also with our advocacy for federal funding, how many programs are struggling with enrollment, how many programs are at capacity. So we need that data, and I'm sure we can provide the link so that you can share that if you have relationships with childcare providers in your community. Next slide. So reopening the childcare centers and the grant funding will not solve the childcare crisis. Increasing ratios, if we increase the ratios and let everybody go back to group sizes, that would not solve the childcare crisis tomorrow. We need to not just go back to normal, we need to look at ways to build it back better. That we need to look at childcare workers' jobs, which were really difficult and important before COVID, and they're even harder now. So Congress needs to move more funding directly into the pockets of childcare providers to keep the lights on so they can retain their staff, purchase critical cleaning and personal supply equipment, and states need to raise the subsidy rate so that providers have access to a living wage and benefits. Our future depends on the early childhood workforce who cares for these children. So again, I thank you for this opportunity to share the perspective of those on the front lines. Shannon?
Thank you, Lynanne and Kimberly, and thanks to Center for Community Solutions and Advocates for Ohio's Children for inviting me to be part of this important panel today. So I'm going to focus on food access during childcare in the coronavirus pandemic, and both of your slides and information kind of kick this off well in terms of what I'm going to be talking about. But next slide, please. Very quickly, if you're not already familiar with Children's Hunger Alliance, we are a statewide anti-hunger organization here in Ohio. We primarily work to ensure food access for children 18 and under, and primarily through the USDA Child Nutrition Programs, which provide meals and snacks at caregiving settings, including early care settings throughout the state. And we are headquartered here in Columbus, Ohio, and have some regional offices. Next slide. So what we do kind of in our normal world, and for the most part what we're doing now, is under USDA sponsorship. I think a lot of people are familiar with the Child Nutrition Program's National School Lunch Program and the School Breakfast Program are very common, and most people recognize those names. There are a couple of other programs that are less common. One is the Child and Adult Care Food Program, which provides reimbursement for healthy meals and snacks served in after-school programs in family child care homes and also in daycare centers. And I'll talk a little bit more about that in a second. We also provide summer food service program sites. This has really ramped up this year, as the summer food service program also is an emergency provision for provision of food that schools use during the emergency, and that sponsors such as ourselves could use to provide food. And the USDA flexibility has allowed us to provide quite a bit of food as well. We also work with schools to increase breakfast participation, especially in high poverty schools who may not be offering breakfast to their students. And we also have nutrition education and physical activity education that we provide in early care and school age settings. Next slide. So a CACFP, Child and Adult Care Food Program, provides reimbursements for nutritious meals and snacks to children and adults who are enrolled for care. The adult piece of that is for adult daycare settings, but we focus on the child aspects of this. If you think of a typical school lunch or school breakfast program and the types of food available in terms of the components, right? So the protein, grain, milk, fruits and vegetables, those are the types of meals that are served in these settings as well, but appropriate for early care settings, for centers and in-home child care. So providers for in-home as well as centers can prepare meals and snacks that meet these guidelines for care and, for their menus, and provide that food to the kids in their care. They do have to meet fairly strict menu requirements, not only for components, but for things like whole grains, reduced sugar, and others. And so we know that these kids in these environments are getting healthy access to food, and during the pandemic, of course, that has only been elevated as a critical need. We know normally about 1 in 5 kids are at risk for hunger across the state, so about 20 to 25%, depending on the area of the state that you're in. But we know that it is likely a lot higher at this point in time. We just don't have the data for that quite yet. So as a sponsor, Children's Hunger Alliance is approved by the Ohio Department of Education, who administers the program here in the state, to sponsor homes and centers. And what that means basically is that we take on a lot of the administrative and fiscal responsibilities on behalf of these centers and providers. We know that there are staffing limitations. We know that staff are, juggling multiple responsibilities every day and doing many things. So we can help alleviate that burden and ensure that their focus remains on the quality of care and the operations of their business or of their classrooms, whatever role that might be. And we can help ensure that they still are able to serve healthy meals and snacks. So And the other big piece, of course, just kind of overarching that, is to provide the regulatory requirements for and ensure the program integrity. And that really talks to the sustainability of the program. You know, if they don't follow the rules and regulations, which of course federal programs have a lot of, then they are at risk for not being able to participate. And so as a sponsor of that program, we can train them and provide technical assistance and ensure that they can continue program operations and make this a sustainable program. This program in particular provides reimbursements for not only the food, but then also helps offset some labor costs with the preparation of food, the supplies, you know, such as the plates and forks and those type of things that surround food service. So it's really an all-encompassing program to support food access. Next slide. So during the pandemic, some things stayed the same and some things changed. And in both of those scenarios, that was a positive thing. So for pandemic licensed centers and homes, those that applied for pandemic licensing and operated, we had a little over half of our sponsored homes and centers that participated under the pandemic license. So in this scenario, they could kind of continue as normal. Of course, the smaller class sizes and, you know, safety regulations existed, but for the most part, they could continue to prepare and serve food. And for families, that was kind of a saving grace for many families who, you know, own financial situation had changed or other hardships had come into play during the pandemic. They knew that their kids could provide or could have access to healthy food when they went to that child care center or home. And so those centers and homes that participated continue to receive consistent reimbursement. We know that the financial, you know, the financial status of centers and homes and those businesses are very kind of on thin ice in many cases. So they did not have to choose, for example, to lessen the quality or quantity of food provided for their kids because they knew that the reimbursement for that food would be there and would be a consistent source of support as they continue to provide care. Some of our centers did face some challenges of sourcing food during this time, especially our centers who were caring for more kids than what, say, a smaller family child care home would. If you think about, you know, if you were in a grocery store, especially early in the pandemic, and there were limitations on, for example, milk gallons and other things, we did have some centers that were unable to source some of those things. And thankfully, the USDA had flexibilities that allowed us to approve them to continue to serve. Maybe it was a different milk type, for example, maybe it was a 2% milk versus a 1% milk, but we were able to approve that to be served. And then some centers and homes, I should say, but centers in particular, use the ACFP to market their centers because, you know, they could reassure families that quality food access was going to be there and be a constant source of, you know, nutrition for their families. And that really happens in, you know, in a regular kind of pre-pandemic world, but more especially during this time of greater need. Next slide. This is a very cool, I think, piece of something that happened under the USDA flexibilities that kind of allowed, especially providers took advantage of this, some of our in-home providers, where under USDA, in a typical world, the regulations require that congregate feeding take place. So, you know, kids are sitting and eating together in a setting and not taking food off-site. But obviously, that's kind of in direct opposition to guidance we have at this point in time. So the grab and go model, as we call it, for kids who were previously enrolled in care for under some of these providers who were not pandemic providers or centers, is an option for them. And so these providers could serve provide 2 meals and 1 snack, up to 2 meals and 1 snack per day per child for up to 1 week at a time. So they could essentially provide a family whose children they cared for with food for a week or several meals a day at least for a week for kids, and continue to be reimbursed for the food that was provided. In many cases, these providers were driving meals and snacks to families' homes because of transportation issues, especially in rural areas. and about 75 CHA-sponsored in-home providers participated in this program during the pandemic. When I sent these slides earlier this week, the flexibility was through August 31st, 2020. We heard yesterday from USDA that that flexibility has been extended through June of 2021. So this, for providers who may not feel comfortable enrolling kids and providing in-home care, they can still continue to provide food access for kids in their care, and centers can also take advantage of this should they not have kids in their care as well. Next slide. This is a long quote. I'm not going to read it, but I think it just kind of demonstrates the importance of the food program and the food access that is being provided for families. You know, kind of that highlighted piece in the middle. We know that some of the children go home at the end of the day, may not have access to food at home, or not a lot of food access. So we know that it's important for them to be receiving that during early care settings, and you know, just the same as we talk about in school settings, where you know, for kids that have breakfast and lunch provided to them during the school year and may not have that access during the summer, it's the same in some of those early care settings. So it's really an important piece of the early care setting, whether it be a center or in-home. Next slide. We are getting asked a lot how people can help right now. I think in the context of early care, you know, a lot of people on this call, whether you're a child care center or a licensed provider or you know of some, we are always looking to assist more centers and homes to become sponsored programs and to help them provide food access. So there's an email address that anybody can email for more information about that. Through our summer food service program, we're doing a lot of meal distribution, and we are packing meals here in our Columbus office. So if anybody's interested in volunteering, you can, of course, always sign up. And then, of course, the link to donate as well. So I know questions were saved for the end of the call, so I'm happy to answer any of those as they come up. Thank you.
Thank you so much to all of our speakers. We do have some time for questions, so I will go to the first one that's in the Q&A box. I think this is mostly for Lynn-Ann, but if others have things to add, certainly helpful. Do you have data about how many childcare providers and how many slots Ohio has permanently lost due to COVID?
Sorry, I had to unmute myself. Great question, Will. I think in terms of permanent capacity loss, I don't think we're in a very good position in terms of data to determine what is permanent. What I can tell you, my understanding of the most recent estimates of kids in care for June was, I said during pandemic care, we were serving around 15,000 publicly funded kids, down from 117,000 on a healthy day in Ohio. We're now up to 29,000 publicly funded children, and between 46 and 47,000 private pay children. So again, it's a great significant contraction of the system so far. There are anticipated that more programs, JFS anticipates more programs will reopen in July versus June. So even though the mandatory closure was lifted, programs have been making choices about when it makes sense based on the feedback they've gotten from their family and the other opportunities that may or may not have been available to their staff and to their program to reopen June, July. And while it's the outliers, there continue to be some that may reopen yet in September or August or September. So we hope that number continues to go up as confidence is increased. But in terms of permanent capacity loss, we have a long way to go to really be able to better anticipate that. Supply and demand, even folks on the national level, I don't want to make it seem as if our state isn't doing the best it can with data at this point. And I know there's always room for data system improvement, certainly. But even at the national level, it's very hard to anticipate supply and demand. So in terms of publicly funded supply, we have a little more concrete information around there, but demand, and even in some of the weekly and monthly parent surveys that have been happening across the nation, predicting behavior is very difficult and certainly varies community by community. So it's a difficult question, but we are keeping track of it as best we can. And at Ground, we're trying to develop some additional tools to be able to measure and anticipate need and really track the story of what's happening here in terms of loss, so we can flip that to inform our advocacy. Thanks.
Thanks, Lynn-Ann. Looks like the next question is for you as well. Just asking about what the state is, do you think the state is taking into consideration what early childhood education advocates are saying as they develop kind of their guidance and things?
Yeah, so I am part of the Child Care Strike Force, which is periodically sought out for advice along with a number of other child care stakeholders. And in terms of the state's understanding and recognition of what we've been sharing, I think they've been as transparent as they can be, and we continue, to demand transparent updates and continue, I think, to receive them. What I have confidence in is that they're taking the best evidence at the time. I mean, I think the governor was pretty transparent when he reopened childcare that he was, really looking across the nation to get the best evidence. Where he didn't have it, he was going to find it here in the state. So there are some additional studies that are happening right now in terms of childcare that we anticipate information on. In the next few weeks, Dr. Walter Gilliam from Yale University, who also sits on the board of the Child Care Aware Association of America, did a national survey of childcare programs that Ohio participated in. And so I am anxiously awaiting to see what he learned about prevalence and also what he learned about the impact of certain policies or regulations. So that one of the aims of the study was to say, if we're telling child care programs to do, say, 20 things, it's really hard to do 20 things very well. But if there's evidence to tell us that if you do these 6 things really well, that there can be a significant impact on containing the virus, then maybe we can make some different choices in terms of regulations. I think that type of information will be informative and the state continues to look for. And there's also another study that involves the testing of child care programs to determine prevalence that the state is engaged in. And we anticipate more information this summer yet, again, to guide their decision. So I think it's hard for all of us stakeholders to feel like all of our needs are being met and heard. And there continues to be a lot of uncertainty, both in terms of funding and just the choices we're making on a daily basis. Kim said it again, there's no playbook for this, but I do think they hear us, and I think they hear and appreciate the desire for some certainty and some helpful plots on the timeline to be able to plan for to the extent they can.
Great, thank you.
So no, I guess that's related to that next question I see. Do you have any guidance as to when the ratios will turn to normal? And no, I don't, but I do think that there's a desire, again, as we anticipate school guidance, that there be updated information around childcare around that time, whether or not it changes, but so that you can continue to plan in the future.
Thanks, Lynn-Ann. The next question, Kim offered to answer this one. Are there regulations on center closure if there is a confirmed COVID case among staff or children? Looks like you're still muted, Kim.
I meant to type it in, but I have entered it into the chat box that ODJFS,
Oh,
that's fine. ODJFS provided a document recently on steps to take should there be a positive case. Each program also, in addition to that, needs to work on their own communication plans to make sure that families and staff and possibly the media are informed with a consistent message for your program.
Great, thank you. This question is around, can you speak more to the July grant not having funding moving forward due to the fact that the state did not anticipate so many grants to be filled in June?
I can answer that one. I think that the state is thinking thoughtfully about what it's learned in the grant process. So the grant both supported a base rate for applicants based on whether or not you're a family child care program or a center-based child care program or a day camp program. And that kind of base rate was to go to increase costs of supplies that you may need for your program in order to operate under the emergency rules, and that again increase sanitation. And then there was a separate payment on top of that that looked at the enrollment of children you have in your center. This is for center-based care only, because it was trying to fill the gap between ratios, which family child care does not have the same depth of impact there because there's a much smaller number of children. So the grant was, again, I am here to say that I know the grant is not enough, and I know the grant is not for long enough. I will not argue with you there. They're thoughtfully thinking about how the July grant can improve in terms of the ability for providers to access it and to get the money where it is needed, which we find primarily to be in terms of personnel, especially as a lot of the one-time expenses have been put up in the month of June to accommodate the regulation. So I don't have any question as to whether there will be a grant in July. There may be some improvements and tweaks to accommodate the budget, but I don't think I don't think that there will be a grant as what I feel confident of. But I don't think that there should be expectation beyond July that the CARES Act dollars could continue to sustain the grant program. But I do feel confident for July that there will be a grant available.
Thanks, Lynn Ann. Next question, over the longer term, what new funding streams for early childhood education appear possible? I imagine there are lots of answers to this. So anyone who wants to jump in on that one?
Well, if you would have asked me prior to the pandemic, I think that we've been really enthusiastic about Governor DeWine's commitment to young children and commitment to both quality and access to childcare. And it's really always been our desire, as it is many advocates, to increase state funding in the childcare system. And that is so that our childcare system is sustainable and can meet the needs of more children and families. So in terms of new or additional funding streams, I think the Child Care Development Block Grant, unless there's a change in revenue in the state, is going to be kind of our number one priority in terms of trying to get more money into the state of Ohio to support childcare. I also think that childcare intersects with so many other early childhood programs, and so we should use this opportunity, as Kim said, as we rebuild, we reimagine that childcare is a system that's part of a much larger early childhood system, and think about and prioritize all the tools and levers that we have to serve kids and families. So one of those would be, our early childhood mental health consultants, for example, that are supporting childcare centers to meet very demanding kind of and growing issues that children and families are having as a result of the stress of the pandemic. So I think a systems perspective is really required in terms of financing to make sure we're leveraging what we do have in the state. But in terms of this emergency situation, my eyes are on Congress to get new money through the Child Care Development Block Grant.
And this is Kim. I don't have any better answer than Lynn Ann just gave, but I do notice in Will's question, also talking about the other alternatives to the PPE costs. And I know that one ask from the providers has been, how can they also be identified as an essential workforce that has priority access to PPE, because for some of them, some have been able to make arrangements just through relationships they might have with a provider within their community, whether it be a grocery store who puts things aside for them, et cetera. But that's not a system solution. And so that's been a request there, is how can childcare even nationally be identified in that way? I do also see a question from Carol in the chat box that you might answer, Lynn.
Sure, and I'll piggyback on what Kim said about PPE. I would also encourage, I don't think that private philanthropy can solve all of our problems, but I have seen on the ground in terms of local communities, both private philanthropy and county governments make certain choices about PPE going to childcare and early childhood education programs. The county, already does procurement. So if they are able to make that choice, that has been very helpful to programs, and the counties have made that choice. And we've also seen other local collaboratives or initiatives. Cincinnati Preschool Promise comes to mind, where they've used their kind of purchasing power to put together packets for childcare programs.
That'd be great.
And Carol, thanks for your first question was, what does the Moving Forward Act include, that $10 billion? I have only read the brief summary, and I'm really excited to learn more, but I don't have all the details of what that include, and I would anticipate that would may change and shift throughout the process, but I'll stay in touch with you on that.
Shannon, so we had a question come in for you as well. Knowing that summer feeding is going to look different in schools and in childcare settings, we know that some centers and schools are have the ability to come up with different ways on how they're going to provide education, if it's a mixed kind of concept at home or if it's going to be in the building. Have you been having some conversations with school districts as far as making sure that feeding opportunities, whether kind of continuing a summer meal program kind of structure or feeding in schools, kind of what that might look like in the fall?
Yeah, I think kind of, if anything, this environment lends itself well to kind of what we're promoting the majority of the time, which is breakfast in the classroom, as a way to provide food to kids. It's a way to, kind of break down barriers to who's eating within kind of this, the classroom setting, and knowing that likely those group sizes are going to be smaller, are going to be kind of contained and moving throughout the day together in a lot of cases. I think we'll see more of food provision in the classroom, whether it's breakfast in the classroom or lunch in the classroom. We know that breakfast in the classroom strategies increase participation the best way, out of all different ones, whether it's traditional cafeteria participation or a grab and go model or something like that. So we think that in many cases that could have some positive outcomes for some schools who could actually provide more food to kids, whether it's breakfast, lunch, or whatever in a school setting. But I think that there will definitely be challenges. Think about if all schools nationwide are doing this, and the equipment needed to do this is a little bit different. If you're serving food in the classroom versus in the cafeteria, I think we're going to see some of those challenges, and just, how food service staff can adapt to what types of foods are served as well. So a lot of learning left to do. I know School Nutrition Association and many, many others at the national level are having these conversations, and the USDA flexibilities are going to continue to be really critical to allow us the most flexibility to best serve kids, where they are, and being flexible to the model that the schools choose to provide for their students.
Thanks so much, Shannon. It looks like there's one more question around, it's in the chat. Can the state use the cost savings available from the decrease in publicly funded childcare attendance to supplement the grant dollars?
Yeah, so going back to the closure payments, because they were based on a weekly attendance of publicly funded kids in a healthy week in Ohio, through pandemic care until reopening, that same funding for our system was going out the door to programs. So there was no cost savings during the closure. Upon reopening, Carol's right, we're serving far less children than we typically would. I think that the question we have to ask ourselves, which I don't think the state, is prepared to, that we have like an answer to today, is how our system is impacted by the changes that have to be made to our state's fiscal year 2021 budget. And while we don't have a lot of state funds that aren't held up in TANF maintenance of effort, one source I didn't mention of funding for childcare is casino funds. So we have $20 million in casino funds. You can imagine that those funds are not going to be there. So all that to say, I think folks are getting their heads around the impact of the state budget. And while it would certainly be our priority at Groundwork to continue to use the ongoing state investment to plug back into these programs that are operating at a much higher cost, I don't think that's this long-term or the emergency solution that we need. But I think that they're certainly looking at that. But you have to remember also, right now the grants are going to both programs that serve publicly funded children and private paid children. The enrollment for the enrollment that the grant is based on isn't making a distinction. However, the funding that is in our regular investments for the Child Care Development Block Grant and TANF have restrictions on the income of the families you can serve. So in terms of how the grant program operates now, it's certainly, even if there was the capacity to fund it with those dollars, the grant program would look very, very different. So more to learn there, and we're asking that same question, Carol, so thank you.
Thank you, Lynn-Ann and Shannon and Kimberly. It was really, I learned a lot. It's so much to think about. I really appreciate all of the information that you shared with us. We might be coming back to you with more questions. I think we got through most of the questions. If anyone has any remaining ones, go ahead and type them in and let us know if you'd like us to share those with the speakers, and we can see if we can get those answered via email. I want to thank you all again for joining us today. We are taking a break next Friday for the holiday weekend, and we'll be back with our weekly webinars on July 10th, focused on the impact of COVID-19 and community health centers. So I think they'll have a lot to share with us around how they've been engaged with ramping up testing and how they've continued to provide care during this time. So thank you all again for joining us. Have a great weekend, and we will see you in 2 weeks. Thanks again.
Thanks, everyone. Have a great weekend.
Thank you.